Hi, my name is Brianne Sell, and my topic is cerebral palsy. So, cerebral palsy is a neurodevelopmental disorder, and it's caused by abnormalities or damage inside the brain that impacts the ability to maintain posture, control movement, and balance. But it does have a wide range of symptoms, and it ranges in severity. So, you could have someone who is completely verbal, can walk independently, can feed themselves, wash themselves, dress themselves. But you could also have someone who can't do either any of those things, need a motorized wheelchair to get around, and also can be nonverbal. And that is due to where in the brain it affects. So here in the highlighted yellow are places where the brain can be affected by these abnormalities. Or where it can be damaged. And then, depending on where it is damaged, controls what part of your body is affected as well. So there's hemiplegia, diplegia, quadriplegia, and athetoid. So prevalence and epidemiology. So it is the most common motor disability in childhood. It ranges from 1 to 4 per 1,000 live births or 1,000 children. And if you had a child that was preterm or at a low birth weight, then your child has a higher risk of developing cerebral palsy. Um, about 764,000 children and adults currently have CP, and 500,000 children under the age of 18 have CP. It's estimated that about 10,000 babies born each year will also have CP. So, CP is diagnosed by brain image testing, EEGs, EMGs, blood tests, and genetic testing. For genetic testing, it can be genetic, and that would be caused by a rare mutation, and that's about 14% of people who have cerebral palsy. Unfortunately, there is no cure for cerebral palsy, but medications and treatments. So there's, besides physical therapy, occupational therapy, and speech therapy, which are all treatments, you also have anticholinergics, and that controls or helps uncontrolled body movements like drooling, things like that. And this is a medication. However, it does reduce the ability to sweat, so it can cause heat exhaustion or a quicker fatigue. And then there's also stem cell therapy, which is very interesting. We'll get to that in a minute. First, I want to go over this chart here at the bottom. So this is showing the age of suspected CP in the dark gray, and then the age at which that individual was actually diagnosed with CP. So you can see it's suspected, early, but not a lot are diagnosed. But that changes over as they get older. So going back to the stem cell therapy, so stem cell therapy is when the stem cells are inserted and they go in the brain, and once they make contact with the damaged portion, they kind of transform, and they help with nerve damage, tissue damage, and also pain. So this is showing improvements in diplegic CP after cellular therapy. So the blue is how many were affected, and the pink is then how many were improved. And for having no cure for this disease, this is an amazing outcome with these different things that you can do, like with speech. Balance is improved immensely with cellular therapy. Same thing with walking balance, standing balance, even speech. So that's fantastic. And then this chart is showing how much of an improvement, and about half see moderate improvement who do get the stem cell therapy, which is great. So how does cerebral palsy affect the exercise response? So individuals with cerebral palsy have considerably low VO2 peaks, which reduces their performance and aerobic capacity. So normally this is with stamina with exercise, so can't keep up and also can't go as long. Spasticity, so muscle tightness, muscle stiffness, that can affect how you're exercising, whether you're doing the movements correctly or not, because of the stiffness in your muscles. You may not be doing, or that individual may not be performing that exercise correctly. Muscle weakness, and that impacts the ability to sustain physical activity over time. So again, getting fatigued quicker because their muscles don't have that stamina, that endurance to withstand that. Balance as well. So exercises that challenge balance and coordination may be more difficult and require additional support or modifications. So whether that be maybe holding on to something or you holding them while they do a balance exercise. And then individuals with CP have a higher energy expenditure when exercising, and that leads to a quicker fatigue, right? Because that is caused, they have a higher energy expenditure because of the muscle weakness, the lack of balance, the lower VO2, that all ties into that. So that affects it. So for the case study, recently in June, I was able to volunteer and shadow at a pediatric clinic, and I got a lot of experience with a wide variety of children. Okay, this is gonna be 2 videos. I'm just gonna say this here now. I have recorded this a few times, and it's just not lasting the time that I need to. It keeps cutting out, so it might be 2 videos. So I'm gonna go from where I left off, which was the case study. But I got to see a wide variety of children with CP with the severities. And one was very interesting to learn about, and that's who I based my case study off of. So here we go. So, this little boy was 10 years old, or is 10 years old. He has cerebral palsy, and he has low muscle tone, spasticity, and clonus. So here's a video of clonus. So it's a reflex that when the foot is forcefully dorsiflexed, it then shakes. And here is a video that I will fast forward till he does it. So you can see here that when it's forcefully pushed, this is a reflex and it's uncontrolled, so he cannot control the shaking. It normally lasts for a few seconds to up to like 2 minutes, 3 minutes. It doesn't last a whole for an extended period of time, but that is common in individuals with CP. So for the sake of confidentiality, I have changed his name. So for all intents and purposes, we're going to call this individual Peter. So again, Peter has CP, clonus, spasticity, and low muscle tone. So he has an AFO, so these braces here, that's what this is. And he also has a walker because he does walk with that. I'm going to get back to this in 1 second, this brace. So why Peter was very interesting is because he had a rare surgery done to kind of help more with movement. So it is called selective dorsal rhizotomy. And I will get into this in a minute, but back to the brace. Because he had this surgery done, he was able to have a brace modification. So most of these braces are in like this L position that you see here, and it is for stabilization and support. Because of this surgery, in the posterior part of this brace, there, right where the Achilles is, there is a cut in the plastic, and so it allows his foot to dorsiflex, and that will help him eventually, as the exercise prescription goes on, to walk with more fluidity. So going back to the surgery, like I said, it is rare. A lot of people do not, with CP, do not get this procedure done. Okay. Sorry, I cut out again. But back to the surgery. It is rare. It's about 4 to 5 hours. It improves mobility, walking ability, stamina, posture, and pain. There are some risks, as you can see here, but ultimately it'll help a lot with walking. Patient goals. So after my conversation with the patient, I asked medical history, symptoms they're having, and then what their goals were. Um, so their goals, his goals is to walk without their legs crossing over. So individuals with CP tend to have when both of their legs, when they walk, they abduct and cross over each other, and that makes it hard to continuously move forward. So that is one of his goals. Higher stamina and cardiovascular fitness, gain muscle tone, and gain strength. He really wants all of that to be able to walk more fluidly. So exercise tests that were performed, a 6-minute walk test and the FIS test. So he got 250 meters in the 6-minute walk test. And the FIS test, which is function in sitting test. So based on the assessment, this was the outcome. The child has mild to moderate limitations to mobility. They can walk independently, but requires minimal assistance. So he does have those braces and he does have the walker. They can independently perform basic self-care tasks. So he can dress himself, he can feed himself, and he can sit up by himself. Communication skills, age appropriate with minimal impairment in speech or language. Incredibly smart. He is verbal and he can communicate. All right. So like I said, his speech isn't or he is verbal. All right. So exercise prescription. So because of CP, all of the exercises will be low intensity and then 3 times a week. So for warm up, it's mostly just gentle stretching. Stretching out for plantar flexion, not really so much dorsiflexion, but the calves and the hamstrings as well being stretched and kind of moving the hip a little bit as well. And then for exercises, so for strength training, we have short arc quads, which is what you see right here. This would be in a supine position, so he would be laying all the way down, 10 on each leg and holding the last one for 10 seconds. And then still laying down hip abductions because like I said before, the legs tend to adduct and cross over. So we're going to strengthen those glutes by doing the supine hip abductions, 2 sets of 10 on each leg, and then more strengthening of the glutes for 2 sets of 10. And then for aerobic exercise, walking on the treadmill for 6 minutes. The speed is mostly depending on how he feels that day. That varies. And then going up and down the stairs, going down once, going up once. And I'll mention this here and I'll mention it on the next slide as well. As you can see, this exercise prescription is pretty short. But as mentioned before, they have a higher energy expenditure. So this exercise prescription would take up a whole hour session in physical therapy. It's slower because of the muscle weakness, the fatigue, things like that. Like I said, low intensity because of the muscle weaknesses, the balance weakness, the energy expenditure, the stamina, things like that. So that's why you'll see that with patients with CP, their exercise prescriptions are a lot shorter, and it does take up the whole session. So that brings me to modifications and special recommendations. So slower pace. So they aren't going to be doing exercises like this, right? It's going to be at a slower pace. So a modification would be, like I said, to have a shorter exercise prescription for them for that day. Um, the progression of the strength and the stamina is very slow in individuals with CP. So modifications will just be very slowly, gradually increasing the intensity. 24/7 supervision, they can trip and fall at any moment from the legs crossing over when walking, even on the treadmill. Because of that fatigue, anything could happen. So a modification or a special recommendation that you may not do with people who don't have CP is to constantly be there, arms at the ready, just in case. And that goes along with constant support as well. And then not having many exercises goes along with what we stated on this slide too. In conclusion, like I said, there is no cure, but there is some therapy. Physical therapy does help. Occupational speech therapy does help. But more therapies definitely need to be researched. That's a big thing that I want to be taken away from this, is that there have been things that could improve it, even though there is no cure. And with the wide variety or wide range of severity, a lot can be researched and done. Another going off of that is that there is a wide range of symptoms. So another takeaway that I hope people take away from this is to read about all the different ways that CP can present itself. It is very interesting, and it can lead to, like I said, new discoveries. And then here are my references. And that is it. Thank you for watching.